Hey everyone, if you've heard that Congress is planning 880 billion in Medicaid cuts, that's not quite right. There's a lot of confusion around that number, so let me break down what's really happening based on some of the key takeaways from a recent healthcare policy session with McDermott and Brian Long from the Paragon Health Institute. Let's clear things up in just 3 minutes. All right, let's start with Medicaid. This is where a lot of the action is happening. The GOP's big focus right now is fixing the funding imbalance between able bodied adults and more vulnerable groups like kids, seniors, and people with disabilities. Able bodied adults currently get a 90% match rate from the federal government, while traditional Medicaid populations get anywhere from 50 to 73%. So, what's the plan? Level the playing field so that resources are more focused on the people Medicaid was originally meant to serve. Now, let's clear up the 880 billion number. That number represents a total budget target for the Energy and Commerce Committee, but it's not all healthcare. It includes things like telecommunications, spectrum sales, and energy development, not just Medicaid. In fact, about 100 to 150 billion of that is expected to come from non-healthcare areas. The actual healthcare portion, that's still unclear. We won't know for sure until the House and Senate reconciles their budget versions. But the bottom line, don't let that $880 billion figure scare you. Not all of it will affect healthcare. That said, 700 billion still sounds a bit scary. Now, how is this going to happen? The big word here is reconciliation. Basically, that's a process that allows certain budget related bills to pass with just 50 votes in the Senate instead of the usual 60. But first, the House and the Senate have to agree on a budget resolution, and they're hoping to get that done by Easter. If all goes well, the final bill could be ready to pass before the August recess. But August is more of a backstop if things don't go as planned. So, what changes are actually on the table? Here's the short list. First, per capita cap. This would limit how much states can spend per Medicaid recipient, but mainly for able bodied adults. Second, work requirements for able bodied adults and Medicaid expansion. This could save between 80 and 120 billion over 10 years. Third, provider taxes. There's talk about lowering the threshold from 6% to 5%, which could save around 60 billion over 10 years. And fourth, state-directed payments. States are currently allowed to pay providers more through managed care. Capping that could bring down costs significantly. So, what does all this mean for states? One big idea being floated is to move people earning 100 to 138% of the poverty line off Medicaid and onto ACA exchanges, where they could use tax credits. States might have to decide if they want to keep covering certain populations, but they'd need to put up more of their own funding if federal support drops. Now, a quick note on Medicare and the ACA. Medicare Advantage could see some reforms, especially around upcoding and bonus payments. Those enhanced ACA subsidies from COVID, they expire in 2025, and the GOP isn't likely to renew them unless they add some income limits. So, what happens next? The budget resolution can be done by Easter. Committees will then work on details through April and May, with August as a backstop if things get delayed. That's it. Big changes in Medicaid and healthcare coming soon. So stay tuned and we'll keep you posted.